So next, I'm pleased to introduce two incredible pediatric psychologists, Dr. Jenn Hansen-Moore from Nationwide Children's Hospital and Dr. Lillian Hayes from right here at Boston Children's. Dr. Hansen-Moore works on interdisciplinary teams supporting children and families with bladder exstrophy and other urogenital conditions. She's especially passionate about learning from families to better support the evolving needs of this community. And Dr. Hayes helps patients and families navigate the emotional and practical aspects of care, from surgery prep to long-term coping. She draws inspiration from the strength and support she sees every day in this community. Together, they'll discuss mental health and procedural readiness, topics that are foundational to our well-being. Thank you.
Good morning. Thank you so much for having us here. We're really honored to be part of this event in this community. Jenn and I today, we're going to talk about what is really kind of just a part of our role, and really along the lifespan, along the continuum, and helping kids and teens and even young adults help prepare themselves, and of course for families to help their kids prepare for all the many different surgeries and procedures they undergo. Nice. Okay. So one thing that we really want to normalize is that preoperative anxiety or pre-procedural anxiety is incredibly normal. A lot of us experience anxiety before giving presentations, for example, or different events that are coming up in our life. And so even if your child is having some worries, some questions about the procedures, it's all okay. It's all to be expected, of course. For young kids, these fears might include being separated from their parents, right, at some point in the process, or being left alone. There can be strange new smells, things you're seeing, right? And of course, lots of kids and teens and young adults, well, really anybody probably fears some experience of pain or injury. That's a big one that I talk about with people. And feeling helpless. For older individuals, there might be this like loss of control, right? The sense that like something is being done to me, and that can feel really scary. Those of you who are a bit older might be concerned and more aware about different outcomes that could happen, and that may contribute to some worries and anxiety. Could be some concern about changes in appearance, whether that's temporary or long-term. And of course, being away from our normal routine, right? Like, what's it going to look like when I'm out of school for the next 3 weeks? Or am I going to miss my basketball tournament that I've been looking forward to? So it's funny, Jenn and I were talking in developing this presentation and also yesterday at dinner, and we were both reflecting on how actually a lot of what we do to prepare ahead of time is giving education. And that starts from the really early parts of even when you're talking about doing a surgery or a procedure. And I think that we really need to be making sure that we're involving kids in those discussions, and we're really educating them about, you know, for example, like, why is this something that we need to do? Or how will it help you? How will it inform us about how to help you moving forward? And of course, and this is a theme you're going to be hearing from me throughout the next couple of minutes, but what am I going to, like, what's going to happen, what to expect? And there's a lot of ways that we can provide this education. There's a lot of really cool dolls, I'm sure many of you are familiar with, right, that have stomas, or, you know, that you can even practice catheterizing. There's a lot of really great books and internet articles or handouts. And then another thing, if you're not as familiar with this, is called a social story. It's kind of like a picture book where, you know, you go through every single step of what is going to happen in a day. So it really gives kind of a broad overview of like from the time you leave your house and you arrive at the hospital, like what's going to happen over the course of the day. And, you know, in many scenarios, although of course there are situations where there's like this, the procedure, the surgery is more urgent, you may have some time between like that initial discussion and when the surgery or the procedure is actually happening. And so in that time, you know, I always recommend, like, this doesn't have to be like the conversation every single day, right? You don't have to be hounding your kids like, how you feeling? You have any questions, right? You can kind of like take time and give your kids the time to process what they're hearing. It may be over cooking breakfast in the morning that they say, hey mom, how many days am I going to be in the hospital again? Okay, right. You know, you kind of can have these like conversations as you go naturally. And of course, if you don't know the answer, you know, I think it's really reassuring for kids when you say, you know, I don't actually know the answer to that, but I know just who to ask, right? And we can get the answers to those questions. I sometimes chuckle at this because one thing we love about our kids is that they have such fabulous imaginations. And I think that in some situations, the only downside is when they don't have the information, their imagination goes wild. And I can't tell you how many times I've been sitting down having a conversation with a 7-year-old who says, but what happens when this? And it's like, oh, that's what you've been worried about? Like, it's a completely unrealistic thing that we know it's not gonna happen. But they worry about it because in their minds, they're kind of imagining and making up and filling in the gaps about what they think is going to happen. So there was this really awesome article that was actually published in a nursing journal that I try to practice. And basically what the author is suggesting is that we think about preparing kids for procedures in terms of like, what's going to happen? What can you do? And how is this going to feel? So along those same lines, even as you get closer to the surgery or the procedure on the day of, and even as you walk through the steps of that procedure, we can always let kids know, like, next we're going to be doing this, or after this, then this is going to happen. Some kids really appreciate having even like a checklist, and your team, I'm sure, would be happy to help create one. And some of us even have those at our own institutions that they can actually check off each step as they go, right? And it's reassuring to know that you're working through it. As I kind of mentioned before, I think it's helpful to let kids guide the conversation and ask their own questions that they have been, you know, thinking about as they get closer. And then in terms of what they can do, so this is really like a practical action that they can take. Or and sometimes I use this as, you know, or I phrase this as, this is your job today. This is what you can do. And this is something that you can actually kind of work out ahead of time as well. So, for example, could be coming up with a plan for your child's involvement. And this could be something so small like, can you hold this catheter for me for a second while I get this other thing over here? Or it could be, can you hold your Band-Aid right there while I put the tape on? It could also be, hey, when we're going to put in the catheter, would you like to put it in yourself? Could be holding the mirror, right? So, and the whole idea of that is that it removes the sense of like, this is happening to me, to I am working with my team and I'm having ownership and autonomy over my body and what's happening. And then of course, you know, coping skills, I'm sure people hear that all the time. We were also laughing about how now kids are getting this education, like in their regular education at school. Even my son, who's 3.5, came home and said, I learned snake breaths, you know, and I was like, wow, cool. So there's lots of ways that we can think about coping, right? It could be kind of those like really traditional skills that we are also able to teach kids, like taking deep breaths or meditation. But there's even something I think really powerful about like, hey, do you got some favorite songs you like to listen to? Like, let's bring your headphones to the hospital. Or you love this book, let's bring the book. You love to play Uno, let's bring Uno, right? Let's pack a backpack ahead of time so that you can put all those favorite things, your stuffed animals, your blankets into it. And so your child is like then coming in for their procedure with all these different tools that they are familiar with that can help them while they're going through these procedures. And then this is a conversation that I think a lot of families anticipate, because what I say this just because I hear sometimes like, they told me it wasn't going to hurt and it hurt, right? I think like the inclination when you talk about pain and discomfort, we want to protect our kids, right? And so the desire is to say, it's not going to hurt, you're barely going to feel it, right? It's actually not true, right? And so like, I think that the detriment to doing that is that when they undergo these, you end up losing a lot of trust with them. And when we see people on the other side, right, when we're seeing them for like some more traumatic symptoms that are happening like after, which Jenn will talk more about, a lot of that has to do with trust, right? And like, now I don't trust anyone. I'm never going to do this procedure ever again. Good luck getting me in. And so I think it is important to acknowledge, I often use the word discomfort, or you might feel sore afterward. But the truth is everyone's pain experience is different. And so part of that might also be like, like other kids feel sore, other kids might express feeling uncomfortable with it, but others don't. And so, but either way, I do think it's important to acknowledge. And then I'm going to let Jenn talk a bit more. Oh, wait, no, I'm sorry. I forgot this slide. Of course. Actually, it's funny, it kind of speaks to it because we do so much work to prepare kids for their procedures that then actually we really need to make sure to pay attention to the after. So it's a good reminder for me. So I also think it can be helpful in coping when you're talking about after the procedure or after the surgery. So planning something like a positive experience, a celebration, right? It could be when you get home, we're going to have like a Mario Kart race party with ice cream, right? Something that they can do sitting while they're healing. That's going to be like really fun. And I think then it changes the perspective from like, we're focusing on the surgery and the procedure to actually, yeah, I'm going to have this surgery or procedure, but then afterward, I'm going to have this like super fun thing that I'm looking forward to. It's also important to, especially if like they're in the middle of their school year when this is happening, to talk about, of course, like what's going to happen with their academic course load. See a lot of teenagers who are like really worried about missing this exam that's coming up, or they're going to fall behind on their work. And so having a plan for that ahead of time, right? So that their teachers know, maybe their teachers are going to give them their work or have a plan to like not make them do some of the assignments, can be really helpful if that's possible. And actually, George, thank you for speaking to this as well, but part of also getting the control could be deciding when the surgery is going to take place. So I want to get through my wrestling season. Great, let's do it after that, right? Or, I really wanted to go to the summer camp, or I really want to go swimming this summer. I don't want to have this over the summer. Great, right? That's like another way that we can give them some control. And then one question I talk about with almost every kid is how to talk to friends about it. So especially if they are missing school, that's a big concern. Like, who do I talk to about this? What do I tell them? What if I want to tell this person, but not this person? Or what if I don't want to share this? So I often help kids like come up with a script, right? Like some way that they're going to explain whatever they would like to share, so that they feel confident that when they go back to school that they can tackle these conversations in a way that feels comfortable.
So something else that I really wanted to highlight is so many of our different psychosocial partners that are available during the inpatient stay. So at my hospital, we work very closely with child life. We have therapeutic recreation specialists. We have massage therapy and music therapy and all kinds of wonderful people, because it really is important to, obviously you're there for the medical care, you're there for the recovery, but I think as much as you can pull in some of those normalizing experiences, some of those positive experiences in a window of time that is very difficult, I think is important. Another thing that I often recommend that parents do for kids is to help kind of document the journey along the way. So maybe taking a couple of pictures or videos of them while they're in the hospital. And, that may include seeing some of the more difficult times, but also, oh yeah, when that music therapist came in and, here's a 2-minute recording of like a fun music session that, that they had during this time. And so then being able to look back over that over time, whether it's the next year, whether it's 15 years, from then, is helpful to kind of incorporate that story into their mind. So once you're home, obviously pain management is one of the big considerations. And so just as Lily was saying, setting realistic expectations for the sensations they'll experience post-op is really important. Really playing up that positive distraction. So, taking a balanced view between you want to attend to your child's pain, and obviously, especially in the short term, and do what you can to help provide support, but at the same time, kind of redirect your attention from like focusing and giving more attention when they're in pain or distress, and actually giving more attention when they're doing something fun or they're not talking about their pain or discomfort. It helps to sort of shape the conversation a little bit more along those lines too. And then also talking about some distress with physical appearance or body changes at the surgery site and things like that, because some of that can be distressing as well, and can certainly be addressed on, and should be addressed on the front end of kind of what to expect. But I think continuing to have those conversations over time and kind of reminding the child, like, it's okay, we expect that this is going to continue to be swollen for a while, things like that. So making it fun if there are certain aspects of the recovery that they're not looking forward to. So I recently saw a young early elementary school age boy who was having a genital surgery and was not in pull-ups before, but would have to be in pull-ups for a week or two following their procedure. And so talking about like, okay, so which pull-ups are you gonna pick? Like, which designs do you want to pick, and things like that. I think also emphasizing when they are experiencing such significant distress, reminding them of the temporary nature and the healing and anticipated benefits that are going to come afterwards. Especially for our younger kids who may or may not have language, but may not have language in the same ways that we do to really fully understand and explain themselves and explain how they're feeling. Just recognizing that pretend medical play is really their way of working through some of those difficult thoughts and feelings and emotions. And so all of the things that Lily and I have talked about really help to set the stage for positive coping. And so with these things in place, we would expect there to be less of a concern for long-term physical symptoms or post-traumatic stress. I think it's also important to note, though, that we would expect kids and families and siblings to have some of these symptoms in the weeks following. Sometimes there's like developmental regression, there's irritability, acting out, and when you're in pain and discomfort, that's not surprising, right? So all of that falls well within the scope of what we would normally expect. So when to seek help or when to seek additional help is really more after we would have expected these things to have subsided. So moving into kind of months after a procedure or years, or just kind of ongoing distress. And so some of those symptoms that we might see include some re-experiencing symptoms. So significant distress at discussion or reminders of having the condition or the procedure, having flashbacks, hyperarousal symptoms, so exaggerated startle responses, difficulty with ongoing concentration, difficulty sleeping, avoiding things, when avoiding talking about things or avoiding things that remind you of the trauma. So that might include, even though my route from A to B goes past the hospital, I can't take that route. I have to take the circuitous route because even driving by the hospital is kind of triggering for me. Feelings of emotional numbness or detachment, or withdrawal from things that they're usually interested in. So I think we can really kind of conceptualize that trauma has taken hold if it's something that's affecting belief about oneself or others or the world, and sort of expanding into some generalizations beyond the specific trauma. And so that's when seeking help can be an important step. And we're happy to answer questions, or are we waiting?
We're gonna do.
Okay.